Do we have a sheet for?
We do.
Yeah, I've given them out already.
Oh,
but
maybe
you haven't got
it's
them.
here, or? No, that's not,
Yeah.
that's not
Hold
you.
on.
We just waiting for you to announce it.
That's all right.
Because you already wrote it. Thank you.
Do you want a tea?
I'm all right, thank you.
Yeah?
I do have coffee and cats and everything.
I would like to look at my knee, if there's anything I can do with regards to treatment of cold sores. Cold sore, you don't know this. Okay, you get herpes?
Yeah.
Okay.
Whatever it's called, the buccal virus.
Okay. Reconstructive surgery on ACL. You are 24 years old.
Yes.
You already have, what do you do?
Well, I did with rugby. And then, sounds good.
College rugby. So from age 2 you had also.
Yeah.
Keyhole surgery in the knee, surgery to repair ACL. So these were repairs, and then you eventually had, oh, okay, that's, is this at the high school age, high blood pressure with regards to my father. Oh, that was cute, you condensed it. Or it condensed it for you. Something's
I think
different
it's
in the
probably
form.
me. They all came in different formats.
Yeah, okay, no.
Somebody.
Which knee? Okay, so what does keyhole mean? Does that mean orthoscopic? Is that the same term?
Yeah.
Okay.
Good to know.
Yeah. Yeah, I mean, no, it's a perfect expression for it. That's exactly what we're doing. Okay. And then the repair, what they did, the first one, it was 1 year in between.
Yeah.
So the first one was for ACL also?
No, the first one, they cleaned up the cartilage and they sewed back some tendons. And then the second one, they took the ligament out of my calf and then bolted it into my knee.
So they basically replaced your ACL.
Bionic knee. It doesn't really work as well.
So tell me what's is the pain?
It's just quite weak, really.
No pain at all?
Yeah, there is slight pain. I get.
Where? Can you roll the pants up?
Yeah.
Sorry, because I want to see the
I get kind of some pain around here,
Okay.
and I get pain at the back.
Okay. In my opinion, his pain has nothing to do with his ACL. It has to do with what they took out. Because ACL, okay, now there's a disagreement between me and Kiiko on this, and I'm going to, of course, I think I win the argument. Kiiko says, no, not ACLs. Oh, first of all, meniscus and ACL, what the hell's the difference, okay? I'm going to tell you something. You can't guarantee which is which. It used to be everybody had meniscus problems until about 1980. Suddenly everybody started having ACL problems, and my question is like, I don't think we know enough. Now there are specific tests for them. So meniscus is supposed to be you're lying down and they move the foot side to side, so there's a rotation. But the thing is, if he's saying ACL, it should show an inner knee eye, and it can also show, in my opinion, just above spleen eye. Okay? So, but he's showing outer knee eye and more gallbladder area, so I'm thinking it's what the issue that he has in terms of pain is they removed something from his gastrocnemius, so the knee is now less stable. So I'm thinking the problem is not so much what's happening inside the knee. I mean, I don't know yet. It's a class on, we don't know. So I don't want to make it sound like, oh, well, I know. I'm just saying, I'm trying to explain to them what I'm thinking.
Mm-hmm.
And it's okay if I'm wrong. I'm just thinking that. And so, all right. And it's weak. So
Yeah.
weakness and pain on the outside. Does it get worse in cold or something like that?
Yeah, over winter, etc. Yeah, it does get worse. It gets stiff. It was okay, was it 4 or 5 months ago? We did some work on it, and then unfortunately I was walking my dog and my dog jumped
They
on it.
pulled you.
No, he was playing with another dog and he jumped sideways into my knee and my whole knee buckled. So it was doing really well, and then that kind of just put it back.
Very
Was the
big dog.
It's a very weak knee.
So unfortunately that kind of put it, I felt like all the work that I've been doing for months on it,
Right.
the massage and the foot back.
Was the pain always on that side since the surgery? Or was it?
It's kind of inside, and then it kind of, it's hard to explain. It's kind of like in.
It's inside.
Yeah, as well, like,
okay,
but
gotcha.
like in level.
Yeah,
kind of there and inside.
Yeah, I get it. Okay, do you know what a foam roller is? Does anybody here know what a foam roller is?
I've got one.
Okay, you roll on the tensor fascia lata.
Gonna hurt.
Oh yeah, it will hurt like hell the first 3 times you do it. You're gonna curse me, but you do it after the first week. It starts feeling a lot easier, and you know. For knees, one of the best things you can do for knees is tell them, I don't know what they cost here, but in the States they cost $10, $15. It's totally worth it. They hate it, rolling on it. But for knees, it's very important, especially someone like him where they took some ligament out. You know, I mean, you know, so the whole knee, because the tensor fascia lata is like the strongest thing one of the strongest things you have in your body. It's always going to pull on the knee. Supposed to, but if it's an unbalance, you have to release, and there's no way to release this damn thing, you know, except to roll. I mean, except to go through the pain. So you kind of have to, you know. So I wish I could show you if we had one, but basically you're on the floor, and you have the roller here, and so let's say this was the floor, and you walk the feet are off the floor, and you're walking yourself up, and your weight is on the roller. And the roller is rolling. It is not pleasant.
It's all on YouTube.
Oh, you can see it on YouTube? Okay, fabulous. So if maybe you can send them a link.
How firm are they? Well,
They are very firm. They're not squishy.
Right. Well, you think it's like, oh, what's that going to do? And then you get on it and it's like, oh.
No, okay. It's 6 inches in diameter and it's round. Okay, so you could, when you're walking, you know, the roller stays here and it's rolling and you're walking over it with your weight on it. Women especially don't like it because they don't have as much strength in the abdomen and the hands, and they feel like I can't do it, but they can. Your foot is off the floor, and it's totally solid. The foam roller, it's not squishy. It's a PVC.
You're going from thigh to knee, more or less, and then back again.
Sorry?
You're going from thigh to knee and back. From
the
waist.
trochanter. No, not from the waist. From the trochanter.
Oh, you look a bit higher.
I have a very long waist, yeah. From the didn't you know that Queen Victoria did? From the crown trochanter up to as far as you can go to the knee.
Okay.
At first, people will start, they'll do just a few inches. They do what they can. So, all right. Let's get you in and on the mouth sore. So remember mouth sores are liver excess?
5 10 minutes.
Sorry, what is it?
Well, sure. Let's finish the conversations here.
Sorry.
It's okay, it's okay. It's just hard to. What was your question?
No, I heard it, yeah.
Okay. So liver excess mouth sores, liver 3, spleen 3, and then by the way, we have for undefined
fine.
knee pain, liver 3, heart 5
No.
combination.
Relax.
So maybe we'll get lucky with one thing. Okay, let's face up. If you don't want shoes and socks off.
Alec, do you mind us videoing?
No, absolutely fine.
I should have asked earlier.
Now, you can see that the usage of his feet isn't fabulous. Sorry. Because, you know, you can see that there's not a lot of, softness in the foot. Okay. Now, this is warm, but this is cold. Yeah, it's colder here. Oh, he wants to see, but in a second I'm going to have to pull it down because of the abdomen. Okay, so is this part of the surgery, this scar, or is this
Yeah, that's
you got hit? With
No, that's
this
where
is
they
part
went
of
in.
So this was okay. So this is the orthoscopic. There should be 3 of them. Orthoscopic, and I'm looking for a third. I can't see. Okay, and this is the keyholes, and this is the reconstruction. Okay, gotcha. Any pain here? Don't think too much. Either it's painful or it's not painful. Just feel it.
No, it's not painful.
Not painful. Okay. How about here? Okay. Nothing?
No,
But this is the area.
it's kind of internal on that area.
Yeah. Oh, okay, because you also said, okay, I thought there were, okay. Anything?
No. No.
It's okay.
And that's where it gets fuzzy.
Yes. When you say fuzzy, meaning
It's like they've cut,
Numb?
they've cut the nerve endings, so it's all like a bit
No.
numb, fuzzy numb. Okay. Numb, but no pain.
no pain, just numb.
So, when I touch you here versus I touch you here, does that feel like I'm touching you through a glove or something?
No, it's on the other side of it. It's like when you touch them. there,
Wait,
that's all
when I
fuzzy.
pressed here, you said that gets fuzzy.
Yeah, but it's like that when that's fuzzy when you press it, not when it does that. When you do that,
Okay, gotcha.
it's like fuzzy
Yeah,
there.
okay, now I understand. Okay, so pressing does feel fuzzy.
Mhm.
Okay. And this feels like I'm touching you through a layer,
Yeah.
like like a little bit further away
Yeah.
from me. Okay. How far away do you think I'm touching? I mean, I just make up a number. No. Because I want to, no, they say, it's okay, they can say 5 millimeters, they can say 5 miles. I want to know, like, afterwards, are we better, you know? So this is a little bit weird. Make up a number, or, you know, it can be 3 inches, 20, you know, 3 gloves, whatever.
Probably allow 2 or 3 inches. It's not.
2 or 3 inches, okay, fine, we're 2 or 3. We want to get it to 0 inches if we can. Okay, fine. All right, just relax.
I think you're a bit far up the bed.
All right, can I poke abdomen? So, first thing, remember, this is a musculoskeletal injury. Let's check gallbladder 26. Compare boom with boom. I think this one's tighter, no?
Mhm.
Okay, so, and you don't seem to mind though, even though I had to tell you it's tighter. I mean, you know it's tighter, but it didn't bother you. Okay, fine. So, when I press here, you just feel my fingers? Correct. Okay. Anything here different than just my fingers? Here, yes. Okay. Now you can tell he's a teeny bit bloated. Your digestion's a little bit slow or something. You know, do you get gas bloating or anything?
Yeah, ish. Yeah,
Ish.
sometimes if I think about it, yeah. Now that I think about it, yeah.
Okay. Oh, now that I remember it. No, because think about it is a different term. Meaning, if I think too much when I'm eating, I get bloated. Versus, oh, now that I remember it, I'm. How about here? No. 1, 2, 3, 4. A little bit here. No, it's okay. And no pulse though. So I mean, rugby
You can
player,
see
what do you-
something, can't you?
Yeah, there's a fluttering, but I don't feel the pulse though.
Okay.
Like this Sunday epic breakfast.
No, it wasn't that big actually.
He ate the blood, the pig's blood.
What is this thing you got sewn here?
Um,
A rugby injury?
no, I think that was when I was cycling. I was a young boy. I fell off. I just cut myself.
Okay. Now, can you compare for me here? Oh, you don't like. Okay. No, this could be compensation because when his knee was bad, he was struck. And how about you're jumping, so something's happening here.
Yeah. Look.
But
Try
this
the other
one,
again.
yeah, this one's
Yeah, that's more painful.
oh,
that's
pain.
second.
But there's something weird here also, right?
Yeah.
Okay, fine. Excuse me. 1, 2, 3. Anything? That's
little
in the
bit
top.
tight, but-
Which one? 1, 2, 3.
See.
2. Okay. All right. Now, I know you have one here on this side. Is it active? Is it painful?
No, it's not well.
Do you
It's
have
just a
any-
scar on my lip.
Oh, okay. Is there anything in the mouth that's now active in terms of?
There's nothing active in the lip.
Ah, okay.
Sorry.
No, it's okay. Relax. Oh, just there's a lot of broken blood vessels, also in okay. So okay. Look at this. Lots of blood vessels broken, and we would say liver. And when I'm looking at the liver, I mean, 25. Things don't show yet. so strongly, so relatively. So I'm thinking something, mouth sores is a sign of liver, granted, but when I'm looking at just looking, I'm thinking something strange for the liver.
What are the broken blood vessels?
Yeah,
Just the
sorry?
red?
Look at this.
Just the red.
Yeah, the redness, but it's I'm calling it broken blood vessels, and they're not exactly. It's not like very varicose veins, but so that makes me think maybe Jue of the liver, Jue of Jue Yuen, possibility, So, any discomfort here? Compare left side and right side. Are they different or are they the same?
Pretty much the same.
How about under the ribs and under the ribs?
Mm.
Yeah, very
much
clearly.
so.
Do you see? I'm lining myself with the ribs. Boom down and almost straight out, right? Huge difference between the two ribs. He's like totally. I mean, I don't know. Do you have scoliosis? Did anybody say you have scoliosis or something weird or?
I know of.
Okay. Okay. Even if you think about it. All right. So, and he says, so he apparently is a liver type, so we get a confirmation for his liver. Here and here, not so comfortable, right? Okay. So. I'm just curious. By the way, any discomfort here?
Could just be tight sometimes.
I'm talking about when I'm doing
Oh, no.
this. No.
No, nothing
Okay.
out of the ordinary.
Just trying the way. So remember you have here and here, correct? Yeah. Hi, how's here and here now?
It's all the same.
It's the same? Okay, no problem. So let's look at liver 3. And now?
It's finally a bit better.
Tiny bit. Can you give me percentages? How much better?
Out of 10, I'd say 4 better.
40%. So 40% better. Okay, fine. It's fine. We can. Okay. So I got some conversation of the best. No, everybody's got a different language. It's totally okay. Everyone's got it. Okay. So let me try combination of spleen 3 and liver 3 and see. I'm just trying to milk what I can out of the mouth sores. Otherwise, I may have to do a different kind of liver. Hi, how's now?
Yeah, that's painful.
Give me the number. It was a 10, and now it's a
10,
what?
now
And then
it's
it
a-
was a 6, 1 point with 2
I'd say
points.
it's that bit, probably about a 5 now. It's just
That's a 5, and this bit?
about 3.
Okay, so this is a 3, and this is a 5. Okay, so we can do more, apparently. We just need to figure out what we need to do more. Okay.
So you added spleen 3.
Yeah, what-
Because the combination for liver, for mouth sores is liver 3, spleen 3. Okay? Okay. Now, spleen 3 is our best point for numbness, for fuzziness. Okay? So, because Nagano's theory is that numbness comes from, diabetics get that, neuropathies and stuff. Numbness is, according to Nagano, is the blood is too thick, not enough oxygen. So we need to, not too thick because of the sugar in the blood, okay, or toxicity in the blood. So this we use for sugar, okay, and then we can use lung 8 for oxygenating. Okay, so let's use the same combination. Okay, first of all, you remember fuzzy 2, 3, right? And fuzzy, you said 3 inches? Okay. Okay. How is 1, 2, 3?
1, can't really feel. 2, I can feel. 3, do you press 3 again, please? 3 is less, slightly damper.
Okay. What I'd like you to do, don't go, okay, we're going to start again. This is 1, this is 2, and this is 3. Now, your job is not to compare 1, 2, and 3. Your job is to compare 1, as it is now, to 1 as it will be in a moment when I ask you again. 2 as it is now, to when I'm pressing on the foot and asking you again, and 3. Does that make sense?
Yeah.
So don't compare. So 1 is a certain way, and 2 is a certain way, and 3 is a certain way. Tell me if they get better Did one get any happier?
Yeah.
By how much?
I said 2 or 3.
2, 3, no, 20 or 30% sort of thing. Okay. How about number 2?
About 50-60%.
Okay, good. And 3?
30-40%.
Okay. Okay. It's just I'm trying to communicate in a clearer way for me, nothing to do with you. Okay, next. Yeah. So, ooh, this foot doesn't.
Yeah, his feet are very restricted, ankle joints.
Okay.
Very
First thing you need to look into in life. Okay, if this is that restricted, it's got to be undone. You know, because otherwise nothing will move. Okay. So let's start with stomach 41. Okay. Hi. How's 1, 2, and 3 now?
One was a little bit better, like 20% maybe.
A little bit better from the baseline, right?
Yeah, from the base.
Okay. So 20%. 2 is what?
Can I feel it again, please?
Yeah. 1, 2, 3.
2 being around about 40%,
Uh-huh.
3 being around about 50-60%.
Okay. Can you do this? Press lever 3 upwards. And, wait, where do you spleen 3 is?
Oh, I didn't realise I was doing this. All right, got you.
You're doing 2. Okay, into stomach 41. Okay. How is fuzzy here? 3 inches?
Still 3 inches.
Okay, hold on 1 second. Let me no. Yeah. It's hard to. Okay. Still 3 inches? Okay, fine. All right. So we didn't get rid of this, but we can affect this. Okay, 1 more. Sorry. How about now?
Still 3 inches.
Okay. So I'm trying to release the ankle. Let's just try this because we know what stomach 41 is doing. Okay. How about now?
Still 3 inches.
Okay, it's okay, it's okay. Don't worry. How about 1, 2, 3? Don't get exasperated just because you have to say the same thing. You don't have to. You don't owe me a better number.
Pretty much the same.
The 1, 2, 3 did not.
Yes,
Okay.
same.
The only thing what I'm doing is I'm trying kidney 6 UB62 to see if I can reconfigure the ankle that way and if it will have an effect. It didn't. Okay, so that's all. Any pain here?
No.
No. Okay. Here or here?
No.
All right.
When you pressed the liver, was it sharp and excess-like or deficiency-like?
Would you call this sharp or dull?
No.
Yeah. Thing is, it's hard. People don't always know exactly what he meant. He's not jumping, so I'm assuming it's not sharp.
I was just wondering because you didn't use liver. You jumped to liver 1 before, but this time you avoided it.
Because he has a symptom that tells me that he's more likely to be liver 3. That's it. Make sense?
Okay, yes, fine. Can I ask another off-the-ball question?
Yeah, please.
Piercing. No,
Piercing
piercings.
the eye, what do I think of it?
Yeah, well, wondering, near gallbladder, not the aesthetics of it, but I've had people who've had sciatica, they've taken out their navel piercings and their sciatica's gone away. So whenever I see a piercing, I think, could that influence the liver?
Yeah.
I think, well, I don't know if it influences, because of the eyes, I see what you're saying. Has anybody seen the jar? Oh, it's back there. Thank you. Yeah, it could have an effect. It's like, so now he's going to have a kidney problem and a liver problem and, anything in the tongue? Okay, then spleen's good. Yes, there could be, but,
Do you bother asking and saying, did your soreness start when you had the piercing?
H2.
Oh, the soreness started at age 2. Right.
I don't need to ask, and I know he didn't get this at age 2.
Yeah.
No.
What age did you get this?
16.
Yeah, I think we're pretty safe. After the operation, it was a consolation gift for the knee.
Put something back.
Hey, you can't play rugby, you know, at least you can get a tattoo or a piercing or something. Look, when I went to acupuncture school, it was around 89 to 91. That was when piercing started in San Francisco, and people would stick their tongue. Like, what the hell do you have in there? It's like, nobody taught me about it. A silver tongue. I heard about red tongue, blah, blah, tongue. And then you start going, wow, everybody in the world has, 30 years ago, tattoos were, and piercings were not the norm. Now it's like, it's the absolute, you just have to like, whatever it is. I don't know what I think of it medically anymore, because it's not, it would be like saying, what do you think medically of the fact that people have a glass of wine with dinner? Well, everybody has it, like, who cares?
No, I just meant, do you feel
No.
that piercings can affect the energetics
Yes,
enough that they could make a physical change?
They absolutely can.
Yeah.
And what's more interesting is that depending on the kind of metal you have, it can make a difference also.
Yeah.
So yes, they can. So let me just remind us that you had here, and this one, this one, this one, a little bit, and I don't think this, no.
A little bit.
A little bit.
Yeah, I've seen
No,
something like that.
oh, it's moving towards, okay, so it's as if it's here, okay? And then liver 1 and liver 2. Now, I just want to check. No, relax. 1, 2, 3. 1, 2, 3. Nothing. 1, 2, 3. 3. Okay. And on this side, 1, 2, 3.
2 and 3.
2 and 3 and 3. You sleep okay?
Yeah, I think so.
Okay.
I think so a bit more, mate.
I don't. Suppose I'm fine. I'll just always wake up before my alarm goes off. That's pretty normal.
You wake up before you. Okay, that's fine. I don't. It depends on when you relax. So they took muscle from here, I gather.
They took the ligament or something from there.
From okay, so that's what I want to check. Relax. Any pain UB40 area?
Yeah.
Yes. Okay, good. So now we have a better reflex. Okay, how about below?
A little bit as well.
This one. Okay, here. No.
No.
So this one and this one.
Yep.
Where exactly are you palpating? Just-
I'm somewhere in popliteal fossa. I can't tell you exactly where, but around UB40. Okay. When I press here, how is the knee?
Yeah.
Yeah, better. Okay. This is the first time you get communication. Okay. So no, if it's better, they get it. The rest is like okay, bullshit.
What you want me to say?
Kidney 7.
Kidney
Because
7.
remember I told you. Remember I told you that I think the problem that he has now is more related to the gastrocnemius issue
Yeah.
than that. So that's what I'm looking at.
Yeah.
So this is how much better is it? Would you say?
About 60% better.
Okay. How about the one below?
About the same 60%.
60. Okay, let's get started with that. And by the way, kidney 7 is best for back of the knee. Back of the knee. Then on the back, I do UB23. Okay, and sorry, how's this guy now?
I'd say like 40% better.
Okay. Let's see, they send you on a quick math course now. The percentage is coming out. How about this?
Yeah.
Happier.
Yeah.
Okay. Okay. How about 1, 2, and 3?
Better in pain, still a bit fuzzy.
Okay, better in pain, still a bit fuzzy. Okay. Would you mind going back to 7th grade and give me the percentages?
Could I fill them again, please?
Yes, you can. 1, 2, 3.
Around 40-50%
Okay,
better.
fine. Are we 3 inches away still?
Yeah.
Okay, no problem. Next. And we still have 40% and 40%, correct? Okay. Let's see what we can do with the ankle. How's this guy now?
That's better.
How much?
I'd say 20% on top of the 40%. So 60% better.
Better or worse, say something like that.
Yeah, exactly. How about this guy?
That's again 60% better.
Okay. Stomach 41 is a super important point. Not just for knees, but just in general, because it changes the whole gait. And I needle it sort of towards kidney 6.
Changes
okay?
the whole
Gait.
gait, meaning.
Because you're standing on it. It's an axis.
Okay.
Far away pain. The toe pain.
Is it okay now?
Yeah, it's fine.
I'm
It's
sorry.
fine. No, it's like a far away pain.
How many inches away?
Yeah, 3 inches.
I was miles away.
What did you just say you needled?
Stomach 41 towards kidney 6. In other words, not directly down.
Always? Or just for this
Always
particular?
unless it's for heel pain, in which case I'll direct it towards the heel,
Okay.
the area of the pain, the
Mm.
heel. Okay, we still have this. Okay. Hello?
About 40% better.
Only 40. What about now?
It's worse.
Worse.
Uh, 40%.
40,
better.
okay. It's okay, it's okay. I'll leave liver 3 and spleen 3 for the end. I'm just going to see. By the way, how is the liver?
Better.
Next. Thank you. You sit here, right? This is not exactly immune, but it feels puffy. So, because remember, I asked him about the sleep. So I originally thought something to do with autonomic nervous system, or could be endocrine. We don't think of endocrine for men, but excuse me for asking. And you take the camera off if you need to answer in a way, because I know it's not legal. Did you take any growth hormone? He's looking at college rugby. Don't they? Don't they take?
It's not quite the same in this kind of
Okay, I just wonder. So you think maybe the secret's about to come out?
Yeah, there's a lot of in weight training at the moment.
Yeah. Okay. So I'm just asking. I just want to know. Okay. Hi. How's now here?
A little bit better.
Okay. Just okay. Just curious. The thing is, tendons and immunity are related also. Hi.
Yeah, it's better.
Lots better.
So you literally would take that pulsing to be nothing? Like,
No, I'm not taking it to be nothing. Hold on.
oh, you're not?
No, I'm not taking it as nothing,
Okay.
but I didn't find a finding on it. No, there is, in my opinion, there is something, okay, this is a person, he comes and he appears like, yo, dude. I don't know what your expression in England is for that.
Cool.
Easy going.
But you see, he has comments on that too. Like, he is not as easygoing as he appears, in my
It's a lot of
opinion.
mental problems.
Let's hear.
You didn't put that in your case notes.
Well, no, I just think I overthink everything.
Okay, you're a worry type person. You're overthinker.
Yeah. I didn't used to, but now I do.
When did you start?
When I
Overthinking.
grew older.
You was about to
When there was something to worry about. Nothing here, right?
Then it wasn't on the table.
may have correlated with excessive recreational drug use.
Yeah, well, I also. Yeah. Okay.
Medical history, Jesus.
Come to a minute around it.
What kind?
What kind of drugs?
Yeah.
I used to smoke a lot of weed
And what
since
else?
I was about 16. I've done MDMA, I've done ecstasy, I've done ketamine, and I've done
No, that's the one I'm interested. Okay, ketamine. What else?
and alcohol.
And alcohol. Okay, so that also explains some of the, okay, so there's a different explanation now to what's going on, which means kidney 7 may not be quite the right phenomenon here.
Like maybe let's mention some of the back pain you get after taking recreational substances.
Got a little bit of back pain on the kidneys and stuff.
Yo, dude!
Patient
I was interesting if it would
confidentiality.
show up without mentioning it first.
It's okay, it's okay. Hi. How's liver right now? I took kidney 7 out.
Can I feel it again, please?
Yeah. Boom. Boom.
A dullish pain, not.
Hmm?
There's not really any difference, to be honest.
Okay, fine, fine, fine. I just took a needle out because I'm thinking of doing something different, and you have here, right?
Mm-hmm.
Okay, so we have this one, and this one, and this one, and how's 1, 2, and 3? Are they at 60%, or are they at 20%, or 40%?
I said they've got worse.
Yeah, I took a needle out. That it makes sense. That it got. So, where are we at? With it?
About 10.
Okay.
10%.
In other words, the stomach 41 was not really terribly useful. No, but because of the substances, I'm going to try detox. Hi, how's 1, 2, 3?
Much better.
How much is much better?
1, I'd say 40-50% better.
Okay.
60% better.
And 3?
About 70% better.
Okay, so it looks like kidney 9 is a better point for him. So remember, we claim that if you have gallbladder 26, should be kidney 7. But he has something else that kind of says maybe kidney 9 is a better option.
So kidney 9 would be more indicated for what, something related?
Detox.
Okay.
Kidney 9, large intestine 15. Okay. So I'm going to do the same business here. You have here, right? Hi.
About 20% better.
Yeah.
Worse.
Worse. If you can avoid words like worse and better, give me
I'd
percentages.
say-
It's just easier
I'd
for
say
you.
just gone back to where it was.
Okay, fine. No problem. No problem. Because worse can be worse than before, also. So.
10% better than the original.
Okay. But this is a lot better.
That's painful.
No, it's not. Okay, so it's not. Okay. So. How about now?
Was better until the end, until it pulled off.
Okay,
It was
so
painful.
We'll deal with that for a second. Where are we at?
That's better, about 50% better.
Great. Don't tell me. No. No change. Okay. I'll get there. What do we have here? Anything
Still
left?
the same. It's gonna be pain.
Same as when we very first started. Okay, so I may need to do 7 regardless. And how much? What's going on here?
It's very, very similar to what it was, really. So maybe about 10% better.
I thought I did a.
Can't feel much pain, the difference, really.
From the very beginning.
Yeah.
But there was a point where you said it was a fair amount better.
It's,
I'm a little confused. Okay, it's okay. It's
So you
okay.
said it got better initially, now it's got worse again.
well,
Well, the problem is I also changed needles because
I
we
haven't
got a
really-
different part of the story.
can I feel it again, please?
You can. No, don't worry. It's okay. Hi, 1, 2.
From the first original pain, it probably is better than the first original. From
Okay.
when you first
All right.
looked at it.
A little bit. You know how I hate those words. And this one.
Yeah.
Even better?
Yeah. Okay. Just I've actually got the pain in my elbow there, so.
Oh,
That's
I'm
kind
sorry.
of overriding.
Oh, okay. Well, you won't. Okay. The elbow's okay now?
Yeah.
Okay. How's the liver?
No different.
If you were going back there where you moved kidney 7 to 9 because you preferred it and you thought you may have to use 7 again, would you sometimes think of doing it when they're on their front? Later on.
Oh,
as a
you mean,
second
no,
point
I
of
can,
view.
7 and 9 can go together.
Okay.
Yeah, 7 and 9 can go together. So since he was more responsive with 7, I changed because suddenly the history changed, but then I'm fine, you know, otherwise I would have checked in advance, but I could have been totally wrong. How's now?
One's more painful.
Okay, let's concentrate on the symptom. Okay, 1, 2, 3.
They're all a lot better.
A lot better? Fabulous. Okay, how is... Changed. Okay. How is this?
The same.
The same as when we very first started?
Mm-hmm.
Okay.
But that was what kidney 7 did on that leg, wasn't it?
Yes, I know. That's why it's gonna may have to come back. How's now?
That is better.
Okay. It's coming back.
Reappear, 7 reappears.
There's no option here. It's just the nature of it.
Oh,
Okay.
and also the smoking generally, tobacco.
Yeah, I've stopped smoking in the last month and a half. I used
Good.
to smoke.
Where are we at with the knee in the back?
It's better.
How much is left?
From the original, do you want it?
Yeah.
The original?
From the original.
It's about 50% better.
50% back. Okay, fine. And 1, 2, 3. They're still happy?
Yeah.
Great. We're still 3 inches.
Less.
Ah.
Inches.
Hmm?
Like 2.5.
2.5. He's a stingy type. It's slow for some people. Okay.
That's a big difference in my work.
Yeah.
Oh, what do you do for a living?
I make furniture.
Ah, see, he's position worker.
Yes.
Plus or minus half an inch.
A little bit. A little bit.
Whoops. The leg's off.
So liver 3, spleen 3, because that's by dogma, and we'll check it in a second if it.
That's for the
I
cold
can't
sores.
compete with furniture workers. It's like not an option for me to. So I'm the kind, just do and see what happens. No one's going to sew off my hands because I.
Liver 3 and spleen 3 were first guided by the mouth.
Yes.
Right.
Yeah.
And now they're going back in because the mouth is.
They
still
never.
out.
They weren't out.
No,
I haven't
sorry.
put them in.
Okay.
The only thing I took out was kidney 7.
But is there a connection now between being guided to liver 3 and spleen 3 from the mouth
Mhm.
and what's going on with the knee?
Not necessarily. It's just I need to treat the constitution before I get too involved in the knee. The thing is, because it's hard for him to tell, I'm going to have to deal with this. Some people, they are not. You're seeing life as is.
Sure.
Some people, you keep asking about the abdomen, they'll drive you crazy. They can't, because of his precision working woodwork or furniture or whatever it is, he won't give me answers in a way that's going to be so useful for me on the abdomen, etc. So I'm going, okay, let's go against the symptom directly on everything. So 1, 2, and 3, where are we at? Still happy?
They're still happy.
Okay. What's the distance?
He's terrified of telling you now.
2.46.
I said it's gone back to 3 inches. Sorry.
It's okay. How about this guy here? He was at 50%.
I say still at 50%.
He's still at 50. Okay. You have a needle, so don't move your arm. I'll move it for you. How about now?
60-70%.
60 or so? No. No, don't be sorry.
It feels better.
Where were you on that?
It's like, wait a second. One day he's a precision worker, and the other day he's like,
What were you massaging there?
I think it's
heart 6.
Heart 6.
Relax the arm. Relax. So remember when we started, I said, unclear knee pain, I do liver 3, heart 5 or heart 6. Okay, so that liver 3 is anyway because of the mouth sores, which is secondary.
What's the reasoning behind the heart 6?
I don't know. But the interesting thing, it did make that one that kidney and heart are both Xiao Yin, right?
Yin, yeah.
Okay, I told you kidney 7 is best for back of knee pain. So, and that's the one that it made better. So, where are we at here?
Still at 60-70%.
Okay, and distance still at 3?
No,
Oh,
that's better.
how much?
Keep doing it, please. That's about 2 inches.
2 inches. Wow.
That's 33%.
Yeah. Hey, right. 33 and a third. Okay, good. All right, so that may give us a clue for something else. By the way,
Oh.
heart, because I can't say if it's heart 6 or heart 5, okay? Heart 5, remember yesterday we saw, is called Tong Li, penetrating mile. Zusan Li, it's another mile in the area. So now what I would do, because I can't remember what, I would look at other points with miles on them and look at, can I affect it, but I would have to actually research that because I don't have it off the top of my head.
Less than 10, half 3 miles.
I already have. So it's okay. It's just, I mean, I'm trying to give you like, these are things that you can play with, for example. But the other thing is I can also think in terms of, now I've seen that there's a heart kidney. There's something in Xiao Yin that we need to look into possibly for him. So it might be useful, you know, now I can sort of go, okay, what else can I do that's going to be related to that? So, it's a little easier in the back, but okay, so I'm just now playing with ideas, okay? By the way, this is okay here?
Still a little bit.
A little bit? Okay, and how about here?
That's still painful.
That's still painful, okay. All right. This is totally non-dogmatic. There's no reason for these. I'm just looking for heart-kidney communication. So we have something called Baomai, which communicates the heart and the kidney. So and it goes from Ren 15 to Ren 15 to Ren 1. Okay. Hi. No change.
20% better.
20. Okay, so that says something. It's here, right? Okay. How about now? Yeah, he definitely does have a pulse, actually. Now
Say again.
it's interesting because I'm feeling it on the right side. Yeah.
Yeah, less painful and pain, more painful than the abdomen.
Okay, I'm only talking. Can you ignore the abdomen?
Yeah.
And can you precise yourself into the neck?
It's better.
It's better. Okay, hold on. Can I undo the thingies?
I was getting in there in a hurry on it.
It's very interesting.
Especially while drunk.
You can let your arm go, because you can't do it because you have needles on it. Can I have some help? Nick?
Do you want a knife?
No, I wanted to be able to get out. Oh, I found it.
You can put your thumb down if you like.
Yeah.
Or drop it down onto the bed.
Okay, good.
Heart 6 would gets if it's the cleft point, the accumulation point.
Yeah.
For like moving.
I don't know. You can take points to mean so many different things. It wasn't my thought pattern, but. Hi. How much?
40-50%.
Okay, fine. Because if I'm looking for, and I have one more to try, but hold on. How much is left here? Thinking.
It's not for much difference.
No, I'm not pressing here.
Yeah, and then back of the knee.
Wait, not much difference from the very beginning?
Oh, it's different. It's different from the
Well,
beginning.
okay. Let's try and do this. The beginning was 100%. You always tell me what percentage is left. Okay. What percentage is left right now? You're making it up, don't worry. 50, fabulous. Okay.
We're making it up as well, don't worry.
Now, how much is left now?
60%.
Okay, so this makes it worse, but it makes the head better. Okay, fine. Trochanter. So, 50%?
Yeah.
Okay. When I press on the leg,
Better.
how much?
From the original?
Yeah, well, always from the original.
60%.
So now 60% better. Okay. It's worth a little distance.
At what point would you maybe say, okay, you're getting some results there, you're exploring, let's flip him over, see what we can find?
I will. Well, but there's no, I mean, he has a few more minutes to be on here, so I can.
So it was a top of trochanter in front, did you go?
I believe the trochanter is here between
Yeah.
my fingers, so I'm on
Okay.
above.
Above, yeah.
Okay, so 60? Okay. Yeah, he's a slow pulse situation, so it may well be that we have to go for the back. There's nothing else we can. All right, so 1, 2, and 3 are happy. Okay. Are we at 2 miles?
2 inches.
2 inches.
2 inches, sorry.
Yeah.
I would not be doing this work, that's for sure. All right. Well, and the mouth sores we couldn't figure out. Okay. Where are you at here? Is there anything here? Discomfort?
A little bit.
A little bit still. Okay. And with the liver, where are we at?
Still a little bit. Just
A
comes
little
off.
bit. Okay. Let me try the joy point just once again. How about now?
Better.
How much?
From the original, about 50%.
Okay. I'm now curious, how much would you say this point alone did? Like from just 2 seconds ago? Is it significant or not? Is it really
No, it's not.
It's not significant, okay, then we're done. All right. All right, let's let you go. You just relax, okay? You okay?
Mm-hmm.
All right. All right, the next person is what time? And someone, when they're fatter, sort of thing,
Swollen front.
what you have on the bumps, yeah, don't move up. You don't want to make the stomach channel go the other way. And you'll actually feel it better going downwards.
Ooh.
So, Nikki,
Oh,
she has good stomach
Hey,
channel.
what did you say? I know it's a bit straight.
I would like have any
Oh,
Do you
yeah.
feel it?
Yeah.
Now, some women, like hers, are sort of noduly and giggy, but some women,
Multiple.
yeah, you'll have multiples. And women who are, chubbier and stuff,
Sorry.
what you'll get, you'll get bigger bumps and softer, but you'll still get bumps.
Yeah.
So there's different options on these. How's this one?
I haven't got any better or any worse.
Okay,
Same.
fine. And are we at 2 inches?
Yeah.
Okay, fine. Okay. So we'll wait another 5 minutes or 5 or 10 minutes to turn them over. Let's get someone else on the table in the back to just, so we can, you can feel happy and then they can give you feedback if it's the
On the
same.
table.
Hmm?
Go on the table.
Go on the table.
Yeah, 'cause
Do you
I
want someone on the table?
I want someone on the table. Do you want to be on the table? Or does Frank want you to be on the
I
table?
want to know so I can try treat him.
It's not long enough.
Yes, I do. But I don't teach it much unless people ask me.
Problem is your
because
trousers
It's a
are
lot
weird,
of
aren't they?
equipment and it's not fair.
But you do use them, yeah.
Yes, I do,
Yeah.
yes. Yeah. Okay, so the first thing I'm noticing, very low ribs, okay, very sharp angle, or whatever you'd call it, and very well-defined navel. So
He
those are the
broke
two.
his ribs.
Sorry?
Just- He has had
Yeah,
broken ribs.
He has huge ribs, but excuse me, I'm just curious to see. No,
I didn't notice that.
no, and it's perfectly normal here. Just lift the card up. Okay, it's okay. We may have to just put the door stopper on there. Okay, so when I poke here, it's fine. Okay.
A little tender.
Okay. So originally, if there was stagnant blood, we went for stagnant blood. We were very interested in it. Now it seems to resolve with other things. Okay. How about
That's
that?
fine.
It's fine? Okay. So if you poke here and poke, do it right now. Okay. No, it's no longer that way. Because it felt to me like it should be a little more. How about adrenal? Yes.
Feels alright.
Feels all right?
It's not painful.
Okay. Because you're going,
Grimace, yeah.
yeah, exactly.
Okay, yeah.
And this one?
It's fine.
Okay. Okay.
Tiny bit.
A
there.
tiny bit. Okay.
Yeah.
How about?
Yeah, that's a little more.
Okay, and
Yeah.
I do feel a pulse for you. Okay, how about
That's a bit
12?
tight.
Tight. And 15.
Not too bad, but a little tight.
A little tight. Okay. How about compare for me left side and right side?
Right side's a bit worse.
Right side's a bit worse. Okay.
Yeah,
17.
it's fine.
Okay.
That's ticklish.
Ticklish, and this one is not.
It's fine, the left.
Okay. How's ticklish?
Gone.
Gone, okay. So sometimes you have to decide. Now, so here's the most interesting features about this, just when you look at this person, I mean, it's not like your regular tall, lanky person. Okay, there's something different in the whole way he's built. Okay, and I'm going to everything, the whole bony structures, everything in him is just kind of like this. Just something, yeah, it's long, but it's like, what?
No, I'm laughing at the description. I'm like, yeah, carry on, please.
You don't think?
No, not at all. The laugh is confirming.
Oh, and by the way, he sweats easily. That's in it. Autonomic nervous system types sweat easily.
Yeah,
in
I
the
do.
hands. Yeah. So the thing about it, so he's long and but it's almost like, I hate to say this, it's sort of kind of not nice, so don't take it seriously.
Oh, please do.
It's almost like deformed. Now he's like, please shut up for it.
He didn't say that about you, did
It's a very,
Everybody's an individual.
there's a very peculiar pharaoh in ancient Egypt called Akhenaten, and he's a very odd being. And you have these pictures of him. He's not depicted like any other pharaoh, and he looks just like Lawrence.
Lawrence the Fair.
What was his name?
Akhenaten.
Akhenaten.
I'll check him out.
Mr. Akhenaten.
He's the pharaoh. Pharaoh.
Yeah.
So what I'm going to suggest is whatever his issues are, and there's an ear issue I understand, if I were to look at like what's the, I mean, and this is just a guess, I would look at marrow. His marrow got formed a little bit oddly in my
Ugly marrow.
odd.
That's random.
That was your interpretation, not mine. Odd. So that's my thinking. So, yeah, so let's check places where marrow may, no, relax. 1, 2, 3.
Yeah, it's all very tender.
4. Okay, 1, 2, 3, 4.
And 3 and 4, but not as bad as this side. This side
Okay,
was
yeah,
all
because he has
much more.
liver, so, okay. So, can you give them feedback on, you said you had something here?
Yeah, a little.
And, okay, so just a little.
This is the main one there.
This is the main one, okay,
Yeah.
so liver. Okay, so if people want to poke abdomen, he can give you some feedback and say, yes, it's the same, or it's like totally different, or it's too sharp, or, you know. So maybe two people or something, and we'll just switch between as we do this.
Is it better to do it from one side?
I like going from the left side. That's my personal preference.
Have a go.
Go.
Right, okay. So, do you start off at just a sort of calibration at when you
I
start
usually
to-
go, you just feel my fingers, they say
Okay.
yes. Okay, then, does this feel different?
So,
Yeah.
and then
Now ketsu.
ketsu, just slightly lower.
Yeah, it's a tiny bit more sensitive, but it's fine.
Okay. And the other side.
That's pretty much fine, I think.
Right, okay.
A little bit.
And
Do you feel right stomach 27 like more, there's more substance there than the left?
27
No,
big.
I'm talking about,
Oh, sorry,
do
sorry.
you feel?
Oh, sorry, I wasn't really sorry. Can I just do it again?
You weren't really sorry.
Yeah.
That's Japanese. It's like, sorry means hello.
Okay. No, I felt this side.
You feel,
just a
oh, okay,
pinch.
because I felt the opposite.
Oh, right, okay.
No, and that's okay,
Yeah.
that's why I was surprised.
So, 4 o'clock?
So, no,
Yeah,
so
sorry.
4 o'clock, we're a little bit more precise.
All right, okay.
Almost on the navel, not quite.
Yeah, sore.
Yeah.
Okay.
And 8 o'clock?
That's okay.
Okay.
Now, can you give her feedback as far as her pressure compared to mine?
Tiny bit stronger yours.
Oh,
it's
right,
tiny
okay.
You know
bit, but it's
why?
actually alright.
Because, yeah, no, she's quite good. What I want you to do is use your body. Think of this.
Okay, all coming from your, yeah, okay. So going on,
Yeah, that's better.
Yeah.
All round, yeah, it's a better way of express.
So now what I want you to do is move a little faster.
yeah, okay.
Don't get so stuck.
Okay.
So use everything that you've done up to now and move. And now do that liver 14, the under liver 14 thing.
Just around there?
Yeah.
Yeah, that's a sensitive one.
Okay. So if you take it too slow, they can't respond to you, so to speak.
Right, okay. Yeah.
Okay. So, you know, kind of like, so you have, I understand you're trying to you know, so also right now we're not really looking at the
Yeah,
patient, we're just
okay.
looking more at mechanics.
Right, okay.
Anyone else? Is that good?
Yeah, yeah.
So go for his
Yeah.
neck. So go 1,
You
2,
go
3,
through, yeah.
and then go for under.
So it's just a sort of bottle.
Yeah,
Yeah,
it's exactly
okay.
right. Give her a second and then you can see.
Yeah, it's quite sore, but that's the correct kind of pressure in place,
Okay.
yeah.
And then go
Yeah, underneath
that way.
and pull towards you.
Yeah, that feels kind of correct, yeah, that's good.
Thank you.
Thank you.
Okay, this is going to be very different.
Yeah, go for it.
I'm not.
Don't worry, no excuses, just do your thing. Okay, my suggestion, get rid of the it's
Okay.
a mannerism from my perspective.
Mannerism. Okay.
Yeah, it's like I'm going to pretend to be, you know, it looks nice,
Okay.
it's not, I don't think it'll be useful.
That's good, good pressure, yeah, feels good.
So go for a ketsu. So left stomach
Left
26,
stomach.
27.
Yeah, again, good pressure, yeah.
So this is very nice. Your hand, you might be able to release the hand a little bit more. It's okay. No, this is good. This part is very good.
Same on the other side.
Yeah. So you're a little bit on the kidney line from my perspective. Yeah.
Yeah, it's tighter there, isn't it? I mean, it doesn't hurt or anything, but I can feel it.
Yeah. See, I feel tighter on the right side.
Yeah, I feel it here.
Yeah, each one's, yeah. Because that's
Maybe we
what
have
she
to
felt
reverse.
also. It's okay,
Yeah,
it's okay.
maybe. Okay, so
Go for adrenal.
about here.
A little closer. So which finger is your feeling finger?
Middle.
Okay, so, yeah, good. And press, as if
Okay.
you're pressing towards the middle of the navel.
The pressure's not quite right. It needs to be sinking a bit more. That's it, yeah.
Oh, okay, I'll get you now.
Yeah.
Because you can feel the bottom of the navel. Damn. It's like my hand.
Yeah, that's it. Yeah, that's very good.
And then on this side, do you go in?
Yeah, same direction, so it has to go towards you.
Yeah, that's it. Yeah.
Okay. And then
Red 12. Red 9, red 12. Now you go faster. Okay, red 9's a little high for my taste. Okay, good.
Yeah, that's good. So.
Go. Release the hand.
Yeah.
Okay. Go for liver 14. Under liver 14. Yeah.
Yeah.
Okay, let's go for the neck.
okay.
It's okay. So,
I'm not quite sure. Here, just here. Was
so
it?
now you can do this.
Was it under here?
Okay, so what I did was boom, boom, boom.
Okay.
So I'm going into the watos, and then I go from this same side, I slide my hand under the spine, and boom, boom, boom.
Go
Press into
down a bit further. That's it. And move down the neck rather than.
Yeah,
across.
not sideways.
Yeah.
Okay, you're moving boom,
Oh,
boom,
okay, yes.
boom. And on the other side, boom, boom, boom. And you're pressing towards the spine.
Yeah, you can even stay a little bit
Release
tighter
the
towards
hand.
the spine, but the pressure's good.
Okay.
Release that, release that.
Yeah, that's it.
No, release, mentally, release that.
Oh, I see. Okay. Over here.
Come towards you.
Yeah, that's very good.
Yeah. Thank you.
All right, so, just out of curiosity,
Thanks.
Mr. Ugly Marrow.
Sorry.
Don't they say ugly marrow, beautiful soul?
I definitely think so.
I thought you would agree. 39 marrow point. Well, and because of the ugly marrow, I have to do it from the side. Hi. How's 1, 2, 3, 4?
2, 3 are bad.
Still bad. Okay. Okay. Well, let me give you the baseline. 1, 2, 3, 4.
Yeah.
1, 2, 3.
No different.
No different. Okay, fine.
Is it below
Ugly marrow, not a good theory.
Is it below the bone you're
Yes.
going?
Yeah. I always because I usually kneel it from the back anyway.
Yeah.
One more. 4, 3, 2, 1.
No, that's all pretty much the same actually.
Okay. Hold on, because it's complicated by liver. You had 3 and 4, right?
I think so, yeah.
Well, I'm giving it to you.
Yeah, it's
You
actually
feeling?
not too bad.
Okay, whatever you're feeling now.
Yeah.
3 and
4's actually still on there, yeah.
4. And 3?
Ever so slightly better.
Okay. Apparently ugly marrow theory is not doing it. Okay.
Yeah. So it's beautiful marrow now.
Yeah.
Beautiful marrow. Hi. 1, 2, 3, 4.
That's quite a lot better.
Okay, so it's liver. Okay, I'm pressing liver 14
that's
outward.
interesting.
Okay, so it's really what the body shows under palpation as opposed to what the body shows in the so-called deformations. But
Amanda thought it looked more tendony, the feet, rather than marrowy.
But look at the bones. Yes, they are tendony, but there's still. It's just an interesting.
Yeah.
So, yeah. One, 2, 3.
That's a lot better.
A lot better.
Yeah.
Okay, so Jing, rank 4. Okay, so and that's a lot better, and it's even better than liver 14.
Yeah, it was, yeah.
Okay, so apparently, ugly marrow is still the better theory. Once ugly marrow, always ugly marrow. No, the reason I'm telling you these things, by the way, Miss Ugly Marrow, nothing to do with me. I said oddly shaped, ugly marrow, oddly. So, the reason I'm showing you these things, I want to show you that, you know, this is part of what I do. You know, it's like I'm looking at people, I'm getting ideas, and I'm trying to fly with them. And either I fly or I crash. And it's okay, you know, it's like I'm not that upset if I crash or I don't, you know, it's like, it's fine, you know. So that's, you want to play these games in clinic also, because if you just operate by the body, you will get lots of results and it'll be fabulous. And if you start playing with your mind as well, don't play with the patient's mind, play with your mind and their body. Put them together, because their mind and their body are already together. Your body and your mind already together. Combination, my mind, his body, what does it do together is fun. Okay, then you get much more results than just going with their body. Allow you imagine, I mean, how many acupuncturists do you know that say, I don't know, I came to this point, you know, and the patients get better. Intuition, right? It's the most common thing that acupuncturists will tell you. That's my intuition. So allow for that to happen, but check it against the body. I'm not against you making up your stuff. I'm actually for it. But check it. Thank you. Let's flip him, and then we'll see if the next person comes. So any more information on this thing? Okay. How about anything here?
Yeah, there.
There? Okay. How about here?
Yep.
And here?
No.
Okay, so here, here, and this, right?
Yeah.
And also this. Maybe we can
put
something. Yeah.
Lift your feet up, Alec.
You look so tiny. Look at
Lift your
how
feet
much
up.
of there. Yeah.
This side is the medium chair. Okay.
It's a good thing because that's immediately sort of released, like, relaxes it.
So, beautiful marrow versus thin legs. Which one do you? No, don't you think, especially he says, I understand that because he was, you know, he was a rugby player, right?
Well,
Don't they usually come in larger sizes than Mr.?
Schoolboy's different.
Windfall.
Schoolboy's different, and different positions. So
Yeah,
he was a
when-
winger,
oh,
so it's not very big.
Okay. Okay, I don't know what, you know, I just know that in hockey the goalies have to do the weirdest thing, they all have thigh problems. So, but it's interesting, if you
Calves are
look,
disproportionately.
that was my point. Yeah, I mean, you look at this, that's one thing, and this, it's like, you can almost say two different legs in one leg. You know, it's like,
What did you say? Feels like it.
it feels like it, yeah.
I love that as well. I think it's rugby uses the thigh muscles a lot, maybe not as much as the calves.
Yeah,
Thigh
this-
muscles would be
well,
overdeveloped.
well, skaters certainly would.
Yeah.
Because they can't, in some ways, it's more like a skater development. The feet are not, their feet don't have much flexibility, and the thighs are bigger than, you know, that will be a skater because they can't use the feet.
Yeah. It
So
does
they
make
have
sense
to
for
use
rugby.
this.
But I have the same as that, I reckon, as well. With the same sort of position.
What happened here?
it's a cyst.
It's a cyst, okay,
I'm getting it removed.
okay. 1, 2, 3, do you feel any tightness?
Yes.
Okay. Split UB20 area is best for hamstring. People can't stretch their hamstrings, but I'll also show you another trick. So, how's now?
Better.
Okay.
Sorry.
No, it's okay. Sorry, you present it if you can.
I'd say that.
Hmm?
I'd say it's all about 40% better.
40, okay. For him, 40 is a decent number. We remember that. Okay, next. You have here and here.
Mm-hmm.
Okay, and then on the hamstring, do you have 1, 2, 3, anything? Hey, what about here? Feel this, it's like a golf ball here.
Yeah, it looks like
He swallowed it while they were playing rugby.
That's right.
It's not a cyst, it's a structure that there's an inflammatory situation there or something.
I feel that too clearly.
Okay, just put your, oh, it's kind of disappeared. God damn. No, you're right. I think you
Sorry.
you played around the tendons and it's okay.
It's gone to the other leg.
It's going to the other leg.
Crazy girl.
Never mind. We can't find it. Okay. So Alec, hold on one second. 1, 2. Which one? 1, 2.
2 is
2. Okay.
worse.
Okay. And then this one and this one. Correct?
Yes.
Okay. Let's try UB20. How is this one and this one?
They're about 50% better.
50. And how about the hamstring?
The same, and that is about 30% better.
Sorry?
The first one
30.
is the same, and the second one is about 30% better.
Let me try this one. The first one is the same. How is it now?
It's better.
Okay. You need to talk a little bit louder because you're talking towards the floor, unfortunately.
Yep.
Sorry about that. Now, one of the things I do, we call bending stretching points, sacroiliac points. So, okay, so you can, in him, you can literally touch the sacrum because it's very thin, you know, he's well, easily built, whatever you'd call it. And then, but I go outside the sacrum. What? You're thin, you know, it's like, what can you do? It's like, so, okay. Men don't like to let go of the buttocks. It's just, thank you. It's hard, you know, because especially him. He's built wide here and it's narrower here. We don't have a choice. We've got to hold this extra bulk we have on top. So we use our butt muscles. We're a little tighter, you know. So, okay. So when I call sacroiliac, I just go from the side until I get gumminess. Okay. Sacroiliac ligament. Okay. How are we doing? 1, 2.
1 is worse, 2 is better.
Worse than from the beginning or worse than the 50%?
Worse than 50%.
Okay, but not worse. Okay. Now, how about this one and this one? Sorry?
Number 1 is better, 2 is worse.
2. Oh. Okay. How is 2?
Percentages, mate, come on.
So, it's 30% better.
30%. We had 50 before. Wait a second.
50%.
Sorry?
No, it's worse than 50%.
Okay, wait. Okay. Let's start. Okay. Number 1, number 2, number 3, number 4. Okay, that's your baseline right now. Okay. How's number 4?
About 40% better.
Okay, thank you. How's number 2?
Same, 40% better.
40% better. Okay. How's number 1 and number 2?
Number 1 the same. Number 2 about 30% better.
Okay. I'll take it.
I'm taking those on.
Well, you know.
So that one you needle, remind me, just
Okay,
down
you
and
needle this towards opposite gallbladder 26, so ideally, but the needle won't stay that way. So you're not needling straight in, but you're needling at an angle, and I'll add a few more on this one. Now, for tight calves, the best combination is opposite side, gallbladder 34, Sanjal 4. Okay. But let me just make sure.
Sorry, tight?
Tight calves.
Calves, yeah.
Okay. Best combination is gallbladder 34, Sanjal 4, opposite side. I don't have the ability to release his calves on this side with gallbladder 34 on this side because that's too close to the injury. But
So did you say Sanjal 4?
yeah.
Sorry.
Hi, how are we doing the number 1, number 3? A lot better?
Yeah.
Okay, sorry, you're still talking towards the floor, unfortunately. You can't change that. And number 2?
From the original, about 30% better.
Okay, so number 1 you're happier with.
Yeah.
And number 2 is still a little stubborn. Okay, fair enough. Don't forget it's go. Okay, how about this guy here?
Still tight.
Okay, so. Okay. Oh. Okay. How about now? Sorry?
A little bit looser.
A little better? Okay. How about number 2?
Yeah, that's better.
That's better, okay. Now, my Sanjiao 4 is straight in the center. I know 2CM takes it on this, on the, external side of the tendons. I just go straight in the middle. Number 1.
Same.
Okay, and 2.
More painful.
Sorry?
That's more painful.
That's more painful.
No.
It's okay, it's okay. How about this 1 and 2?
1 is more painful now, 2 is better. So 1 I didn't feel anything before.
Okay, it's okay, it's okay. So let's check L5. Anything here?
Yeah, okay.
This one?
Yeah, pain there.
Okay, when I press here, how is 1 and 2?
A lot better.
A lot better, great. And how is 1 and 2?
Painful.
Both of them painful?
Both of them painful.
Okay, since that's his symptom, I need to be careful. Okay, let me move it slightly to the side. Hi.
1 is better, 2 is still the same, painful.
It's sort of the same, but it's not worse.
No, it's not worse.
Okay, let me take it slightly to the side again. 1
It's better.
and 2.
Still worse.
Hmm?
It's still the same pain.
Still the same. Okay, let's try and get rid of 1 and hope for the best with 2.
So if you press there and the injured area makes pain still, you have to, be careful about needling that?
Yeah, I don't, but if it's still pain, it's okay. So 1 was resolved, 2 is not resolved. If he says 1 is better, but 2 is worse, I don't want to use that point. Okay. So 1 is relatively okay?
Yeah, still the same.
Sorry?
Still the same.
Meaning
Better.
not so
Meaning it hasn't changed in pain.
Okay, how about 2?
Still painful.
This one's still painful. Okay. I'm sorry, you're giving me 2 different measures here. This is still painful and 1 is...
Still the same, but then same
I'm not
good.
sure. I'm sorry. It's just hard for me to understand.
It hasn't changed in the last 5 times you've prodded it. It's still exactly the
Number
same.
2 hasn't changed and number 1 hasn't
Number 1
changed.
hasn't changed the last 5 or so times.
Number 1 has not changed. Number 2 has changed?
Yeah, it's gone
For
up
the
and-
better?
No, still, it's gone up and down, but now it's down.
So number 1 got a lot better.
Yeah. So what percentage is
But it
less? Could you just give a percentage of how much it hurts?
What's going on?
You poke it again, please.
What was the answer?
You poke it again.
Press it again.
You press number 2,
Okay,
please.
okay. Number 1, number 2.
Actually, that's really painful, number 2. I'd say that's exactly the same as when you first prodded it. It hasn't got any better, it's still really painful.
Okay. Number 1, number 2.
Still painful.
No change.
No change.
Fabulous. Okay, I get it. Okay. Anything here?
Yeah.
Yes?
Mhm.
Fine. Excuse me. Remember his liver? Hi.
Better, 40-50%.
Okay.
So just run me through that.
UB35.
Mhm.
On the back, for any liver type, we do UB35. Now, let's see what happens. The golf ball came back.
Oh yeah, I can see. Is that how he holds
Yes,
his?
yes,
yeah.
the tightness of the
Mm,
muscle.
no.
Now he's starting to let go. Okay, how's number 1 and number 2?
Still the same.
Still the same? Okay, fair enough. It's okay. It's okay, it's no problem. It's your knee, not mine. I don't know. Hi, how's 1 and how's 2?
1 is about 30% better, 2 is exactly the same.
Okay, but exactly the same, at least it's not doing harm. Okay, so this is basically the 4 corner. So one of the things that Four Corner does is it's blood supply to the leg. And I'm just going to go for a little bit more spleen to try and relax this muscle. So 1 is better, but 2 is exactly the same. Oh.
No. If you push deep, it really hurts.
I'm pushing the same, I swear. How is 2?
Still painful.
Okay, I understand, but not as horrible as 2 seconds ago?
Yeah.
Okay, fine.
Sorry,
2.
what did you do different
Still
then?
the same.
Okay, 1 second. 2.
Still the same.
2.
Still the same.
Okay, fine. L3, that's our last effort on this one. See if it's from the hip. In 1 second, I'll answer the question. Hi.
Yeah, still faithful.
You're enjoying it, aren't you? All right. Sorry about that. Hi. 1 and 2.
1 is painful now, 2 isn't painful.
Can you press under the third toe? Both sides. If you had a third leg, even better, because we need all the help we can get. Okay. 1, 2.
Yeah.
Now, did I tell you that when they piss me off, it's under the third toe, or did I not? Did I prove my point?
Sorry, where were you on the thumb?
Okay,
Yeah,
I'm on the I'm on the actually sort of mastoid, and actually I
Mastoid,
missed
right,
the
okay.
point. I need one more needle. Okay, the story is with a mastoid. Okay, if you look at Yamamoto, he will say for sciatica and knee, that's the area. And I did study with Yamamoto, so I can't.
Oh, is that the scalp acupuncture?
Yeah. So he has lots of interesting tricks and ways to map the body, but I never studied with him, so I can't really tell you much about it, but I know that this area has, so I'm trying, because I don't know, he chooses points differently, and,
Right,
and he
okay.
does only his specific, it's not like he's doing body
Yeah.
acupuncture, etc.
Is that gallbladder 12?
Now, Nikki, you were pressing here, right?
Yeah.
Okay, good, good, good. I just
No,
wanna make
fine.
sure.
Probably a bit higher than that, actually.
Meaning,
Yes.
so you were more jouet. Okay, fine, no problem. Okay. So I'll do under third toe, because jouet of third toe, because we don't have a jouet point for the third toe anyway, is like under third toe. So she wasn't exactly a jouet, but she was a little higher, so I just want to make sure I duplicate. So I did under the third toe, because, so first of all, let me try. 1, 2, I'm not seeing any thumbs.
Yeah, painful. Better, but still painful.
Oh, better, okay. So we'll go for what you did. So I just want to, okay, you did here.
Yeah, a bit
Okay.
more dry.
Hi. 1, 2.
1, fine, no pain. 2, more painful.
Okay, hold on. Let's go for real jouet, in which case. Hi. And boom. So jouet. See, I wanted to do jouet of liver originally, but it didn't do anything. But
So
jouet of
that's
third toe.
So is it Shaoyang?
No, this is not Shaoyang.
Just
Shaoyang
third.
would be here. Taiyang, Shaoyang, nothing.
Okay. Wuji.
New point just discussed.
Sorry. No, new point was just discovered. Maruyama said, okay, look. It goes like this. Maruyama said to go do it by the channels. When you look at the toes, you have spleen, liver, stomach, nothing. Gallbladder, bladder. So who's that? Akabane, okay, said how come? It's impossible. So then he started looking. What's nothing? Diaphragm line is nothing. Therefore, third finger, third finger, third toe, this is pericardium finger related to autonomic nervous system. third toe, you can say related to stomach muscle channel, because there is the muscle channel that goes there. It's not like there's no channel. But he said he found, because what he did was he would do the Akabani and he would check if the back shoe points are better. Okay, he would do with Maka stick, you know, like heating up the Jingwell point, how sensitive it is, and correlating it to the back shoe points. That was his specialty. This is, you know, 19th century guy. So he said the third toe is related to the diaphragm shoe, therefore related to the autonomic nervous system. For us. I'm so sorry. Done. Boom, boom, and boom.
The first two are fine.
And the third one, how much is left to here? How big a deal?
Not that big.
Sorry?
Not that big. It's a little bit of pain, it's not that big a deal. That's made it better.
Sorry?
That's made it better.
That is native? Yeah. Okay, so you can see, can I have one of those green needles? You can see that sometimes you've got to do something else before, because we tried for with liver. You know, and because it's tendons, it should be liver. Okay, so, sorry. Where are we at? The thumb isn't going up, okay.
Yeah.
Is it better or not?
Still painful.
Okay. We'll leave you for a moment. We'll see where it's at. Are you okay?
Yeah, that's
You're
fine.
comfortable? Okay.